the number one best food in the world that can help unclog your arteries, prevent a heart attack and a stroke. This is better than aspirin. Aspirin's been around for 4,000 years. I don't know if you can see it, but it's a tiny little over-the-counter pill that's used for pain, fever. And yes, aspirin has saved a lot of lives. Hundreds of thousands of people over the years have been helped by aspirin. Before 2022, a lot more people were taking aspirin. And I think it was recommended for everyone over the age of 60 to take a baby aspirin every day to prevent heart attacks and stroke. But then a report after 2022 said, no, not everyone should take this because there's some slight minor complications like bleeding ulcers, bleeding in the brain. So aspirin does come with a package. It can cause side effects, and it's not for everyone. The reason why a lot of people take aspirin to help prevent a heart attack is because it thins the blood. What I mean by thinning the blood is it reduces the formation of a clot. 80% of all heart attacks and strokes come from a clot, not the blockage of cholesterol building up and forming a plaque. And just as a side note, almost 50% of heart attacks occur between 6 a.m. and 12 noon. And my theory about that is you have higher levels of cortisol in the morning, and both cortisol and adrenaline can increase clotting and increase your chance of getting a heart attack or stroke. This is why you have something called the broken heart syndrome, where a loss of a loved one can increase your chance of getting a heart attack and a stroke by like 2,000%. Let me simply explain what aspirin does. In your blood, okay, you have these arteries, right? And you have red blood cells that travel through the arteries. They carry oxygen. You also have white blood cells, your immune cells. But you also have these little things called platelets that are attracted and respond to injury. In other words, if these were platelets and they're responding to an injury, they would start to connect and form a clot. Some people take this other drug called warfarin, which blocks vitamin K1. It prevents that superglue from forming, keeping the blood thinner so you can prevent a clot. What else could do the same thing, but with less side effects, if any side effects? And before I talk about the actual food that will do this, let's talk about the active ingredient in that food that does the magic of preventing this clot formation. And that compound is an omega-3 fatty acid. Now, when I say omega-3, you might think of fish oils, right? And that's true. It's in fish oils, but it's going to be a little more specific than just fish oils in general. In omega-3, you have two things. You have EPA and you have DHA. The real key factor is the EPA part of that omega-3 fatty acid. How does it compare to aspirin, for example? Well, in this study, they showed that EPA worked to decrease clotting comparable to low-dose aspirin. EPA has the ability to stabilize vulnerable arterial plaquing by decreasing inflammation. And when you decrease inflammation, you also reduce the chance of rupture and having some plaque break off and then float through your artery. There's also another study, 2019, patients were taking EPA, which is the omega-3 fatty acid, and they had significant decrease in plaquing, decrease inflammation, and decreased cardiovascular events by 25%. What's even more interesting is EPA has another effect that goes beyond anti-clotting, and it has an effect on your mood. It has the effect of reducing cortisol and adrenaline. Remember I talked about that? So we have this additional benefit, which could also prevent the clotting formation. How does EPA work compared to aspirin and warfarin, which are blood thinners? Instead of making super glue, you'll get platelets that float around, but they're not as sticky. The omega-3 fatty acid EPA replaces a key ingredient, so the superglue can't even be formed in the first place. Why do I like that approach so much? Is because there's no side effects. Aspirin and warfarin have side effects, but EPA really doesn't. If we look at the best food that has EPA, you do have salmon, mackerel, you have any of the fatty fish. You also have fish oil, and all of those have plenty of EPA. But there's one additional food that has some extra benefits that take this to the next level, and that would be cod liver oil, as well as cod liver. But either cod liver oil or cod liver will give you EPA, but it also gives you two additional factors that can, like I said before, take it to the next level. Vitamin A and vitamin D. Vitamin A, and I'm talking about the active form called retinol, it helps the repair of the internal skin of the body, the sinuses, the colon, the lungs, the inside of the arteries. Vitamin A has potent anti-inflammatory effects. It can also help decrease atherosclerotic plaquing in animal studies, but adding vitamin D in there takes it to the next level. In one study, out of 1,000 compounds, vitamin D was the most effective to prevent damage to the internal layer of your arteries. This is why a lot of people take it for high blood pressure, because it increases nitric oxide through that inside layer called the endothelial layer. Vitamin D decreases the stiffness of the arteries. It's a potent anti-inflammatory. It helps to stabilize plaquing, so the plaquing doesn't plug up an artery. It also has been known to help prevent rupturing and decrease arterial calcification with the help of vitamin K2. So the number one best food for unclogging your arteries or maintaining the health of the arteries to prevent a heart attack or stroke is cod liver oil or cod liver. And again, you can buy it in a can. Make sure it's wild caught. Thanks so much for watching, and I will see you in the next video.